Immunoserology Case Study 1. Good day, I am Yul Vincent Agustinus and I am going to do the introduction for our case study. So, a 6-year-old patient named John presented in the accident and emergency department with a 2-day history of malaise or overall body weakness, fever, hematuria or blood in his urine, and a puffy face. He had no history of renal disease or abdominal trauma, and in his medical history, it was noted that he had a sore throat some 12 days before, which had settled without a visit to his GP or general practitioner. His mother remembered that he had received the standard immunization schedule. Upon examination, John was febrile, having or showing symptoms of fever, had preorbital edema, which is a term used for swelling around the eyes, or also called puffy eyes, and ankle edema, which is a swelling in his ankles. Note that if you experience severe swelling or edema accompanied by other symptoms such as abdominal pain, headaches, infrequent urination, nausea and vomiting, or vision changes, call your doctor immediately or go to your physician immediately, for these can also be indications of serious illnesses. John's blood pressure was 130/90 mmHg. The normal blood pressure for a child 6 to 12 years old for systolic should be 97 to 131, and for diastolic it should be 55 to 62. The skin on his face and trunk was peeling, and he had a reddened tongue, which indicates infection or inflammation. The rest of his examination is unremarkable. Thus, to further present to you the lab findings and discussion of tests, here is Ms. Alcontin.
For John's laboratory findings, we actually found hemoglobin, white cell count, platelet count, serum albumin, sodium, potassium, chloride, urea, which are the basic. However, what really made us determine that it's post-streptococcal glomerulonephritis is because on the urine visual inspection, we actually found out there is a microscopic hematuria, which is very common. Actually, proteinuria and hematuria is very common for PSGN disorder. Along with microscopy part, we found 5 white cells, red cells, and most importantly, granular cast. So, normal findings for PSGN is actually the urine sediment includes red blood cell cast, white blood cells, granular cast, and rarely white blood cell cast. For this one though, we could share to you our the lab results that we have found for John. Let's tackle now the treatment for streptococcal glomerulonephritis or PSGN. For this one though, there's no specific treatment yet for this disorder because this is focused mainly, or the treatment is focused mainly to relieve symptoms. We could use antibiotics such as penicillin. This will likely be used to destroy any streptococcal bacteria that remain in the body. Also, blood pressure medicines and diuretic drugs may be needed to control swelling and high blood pressure.
Hi, I'm Melina Rizzo, and now we're going to talk about the pathophysiology of post-streptococcal glomerulonephritis, or the PSGN. PSGN begins with an infection caused by strains of group A beta hemolytic streptococci bacteria. This particular strain of Streptococcus has a specific antigen on its surface that classifies it into a group called group A, where the type 3 hypersensitivity reaction is triggered. This group also produces an enzyme called streptolysin, and when the bacteria are grown on a petri dish of blood, the enzyme completely lyses RBCs that are close to the bacteria's colony, which a process is known as a beta hemolysis. As opposed to alpha hemolysis, when cells are truly destroyed but only suffer little damage or bruises, beta hemolysis causes them to be completely annihilated. These complexes cause the glomerulus to become inflamed. This inflammation results in the activation and deposition of C3 complement, inflammatory cytokines, oxidants, and proteases, all of which cause damage to the podocytes. As a result of the damage, bigger molecules like RBC and protein might enter the urine and induce disorders related to the uric system.
Clinical hypothesis. The results have shown that John may have post-streptococcal glomerulonephritis or PSGN. In order to prove that the patient has post-streptococcal glomerulonephritis, they prescribed with benzylpenicillin. By taking the prescribed medicine, the patient was healthy and showed no symptoms of renal impairment at the follow-up visit. Therefore, John was cured from post-streptococcal glomerulonephritis. Post-streptococcal glomerulonephritis or PSGN is characterized by rapid deterioration of kidney functions due to an inflammatory response or type 3 hypersensitivity reaction following streptococcal infection. This condition results from specific strains of group A beta-hemolytic streptococci called nephrogenic streptococci. The disease affects the glomeruli and the small blood vessels of the kidneys. Post-streptococcal glomerulonephritis or PSGN results from a bacterial infection that causes rapid deterioration of the kidney function due to an inflammatory response following streptococcal infection. PSGN most commonly presents in children 1 to 2 weeks after streptococcal throat infection or within 6 weeks following a streptococcal skin infection. When symptomatic, PSGN typically presents with features of the nephrotic syndrome such as hematuria, oliguria, hypertension, and edema, though it can also present with significant proteinuria.
The characteristic features of post-infectious glomerulonephritis on kidney biopsy are a proliferative glomerulonephritis on light microscopy, bright C3 staining with or without immunoglobulins on immunofluorescence microscopy, and subepithelial deposits called humps on electron microscopy. It should be pointed out that in some cases, the diagnosis of post-infectious glomerulonephritis is made based on these biopsy findings, even in the absence of any clinical, bacterial, or serological evidence of a preceding infection.
For long-term prognosis, actually, the prognosis of PSGN in children is very good. More than 90% of children make a full recovery. Also, for adults though, with PSGN are more likely to have worse outcome due to residual renal function impairment.